Live. Hello, it's Dr. Ron here. Join me. This is Mimi. She's a dietitian. This is Chef Tim. Say hi, Tim.
Hi.
We're going to talk a little bit about sugars. This is a debate between the doctor, the chef, and the dietitian. Sometimes we can be on different pages, but this will be good to know. Hey, Eric. Thanks for joining.
We're going to try to be nice to each other.
Hey, GABZZ91. Thanks for all the hearts. Appreciate it. Okay. We're going to talk about sugars first. So this is Mimi. Hi, Mimi.
Hi.
She's a dietitian.
I am.
Hey, Deb. Let's talk about sugars first.
All right.
What do you think about sugar substitute?
I think where it depends on your priorities. So the thing is that sugar substitutes, all right, they're artificial. They're usually a lot more times sweeter than regular sugar. And so that's why substituting it has that same type of threshold that you're used to, but you don't add those calories on. Now, why do I say that it depends on where your priorities are? Well, because the thing is that you're trying to kick that sugar habit. Having something that's going to be 100 times, 200 times sweeter and you're using less, you're still maintaining that same sweetness. So if you're going to be eating different types of foods that you don't use sugar, you still, want that certain level. You still taste a certain level. So in that case, does it really help change your habits and your taste in food? Not really. But if you want to use it as more of a crutch in the meantime while you're trying to wean it down and have more of the different type of flavorings to kind of kick that sugar habit, I would say that would be best.
Okay. That's a great point. It really depends on our goals, I think, and I think you're right. And I think you're right. It depends because, for those people who are diabetic, we want to cut down our sugars, obviously. Mm-hmm. And so, a lot of times we do reach for sugar substitutes. And the question is, well, does it do anything differently to my body, right? Mm-hmm. In theory, sugar substitutes should be better because it's not sugar, right? What normal sugar does is that, once it enters our body, our pancreas releases insulin. It allows the sugars to be absorbed by the muscles for it to be used. If it doesn't use it, you kind of turn into fat. And so what happens after that is that as you develop more and more, tolerance for the sugars, you become very insulin resistant. As the insulin level rises in your body becomes very resistant to it. And the more resistant you become, the more likely you are to develop type 2 diabetes. So in theory, going from sugars to a sugar substitute may be better. Mm-hmm. But, in actuality, what happens for a lot of my patients is that once they eat something sweet like a sugar substitute, is that after they eat it, they crave sort of other carbohydrates in the meantime, right?
So they feel like they did something good. Oh, I can now have something else because I did so well not having that extra sugar. So it's kind of like the whole idea of going for low-fat diet foods, those type of things. You feel like you did something great because you didn't go for the regular, but then in actuality, you made up for it in another way, where it's like, I'm going to choose this now because I took the calories out of the sugar, and now I get to have this. So it tends to play a little bit on our psyche a little.
Right. So this is Chef Tim right here. How's it going, Chef Tim?
Hey.
Chef, Chef Tim, he does healthy cooking demonstrations all over Houston and Texas in general. And so what Chef Tim does is he helps a lot of people really understand what they can do in terms of being healthy when they cook. So, what are some common questions that people ask you about sugar and sugar substitutes in general?
The most common question that I get during demonstrations are most people that attend a demonstration are diabetics or have somebody that's diabetic in their family. And the first thing that they're told is sugar is bad for them. They can't have any sugar, and they look for alternative methods. And so their concentration is on sugar substitutes. And my thoughts on sugar substitute, it's non-nutritive, and I'm more of a natural guy. I believe in, all natural foods. And if you're gonna substitute something for something that's not real, then it becomes an issue because it's not used in the same sense as it's supposed to use. Rather, like if you use sugar versus sugar substitute, my thing is anything that you eat, you want to receive the nutrients from it and the calories, because the calories is energy. And so why substitute anything that you're not going to get energy from?
Right, Chef. You know, one of the things that Eric just brought up just now on Periscope, and that's actually my next question, is when you use sugar substitute versus sugar, how does it affect recipes in general and baking and volume? So,
as far as taste, the taste is different because, to me, sugar substitutes has an aftertaste, and I think that you have to use more. Like, just say for instance, we talk about Splenda. Splenda is 200 times the sweetness of sugar, so you have to watch how you use it. But it also can affect the taste of whatever you're eating. But do you want to go with something real, or do you want to go with something artificial?
And also, you know, different type of sugar substitute. I did a little post on, you know, trying to see different sugar substitutes, what it really does, and also how it affects baking. Can you cook with it, and what the FDA said about it. So stevia, Splenda, the Equal, the Sweet and Low. I mean, we know it as by colors now. You know, the blue one, the pink one, the yellow one, and now the green one. Exactly, the stevia green one.
Yeah.
So certain ones you can cook with, certain ones you can't cook with, certain ones you can bake with, like Splenda, how they're saying you can bake with it. But because they're not really sugar, you don't get that same caramelization, right? So if you wanted to use it, you know, like in a saute, you know, where you want to kind of brown, you know, caramelize, you're not going to get that same effect because it's
if you read the ingredients on the sugar, substitute sugar, it's always mixed with a chemical. So do I want to have a chemical dish, or do I want to have a natural dish? And so I'd rather go with something that's all natural, that's going to bring the health benefits, versus putting extra chemicals in my body.
It's like the whole controversy about, you know, back and forth the research of which ones causes cancer, which one adds, you know, a little bit more of the negative effects to it, which ones, you know, people are saying that, oh no, it was only in rats, you know, it's not in humans. So, you know, it really just depends on what your priorities are, what your goals are at this time, right? If you feel that it's going to be supportive to your goals, if it's going to keep, you know, within your guidelines of how you want to taste certain foods, what you want to prioritize, right? You know, in that sense, then that's really what it comes back to, right, Dr. Ruan?
We answer questions. We do answer questions, but a lot come up, so I want to tweet out some of the questions to the answers. But one question that came up is, can you get diabetes from having natural sugar versus processed sugar? And yeah, absolutely. Absolutely. It doesn't matter what type of sugar it is, but natural sugars, and it doesn't even have to be sugars per se, but carbohydrates in general, consuming large quantities increases your insulin resistance, and you can get type 2 diabetes from it. Someone else earlier asked, both my parents are type 2 diabetics. Am I doomed? No, you're not doomed. I have a very strong family history of type 2 diabetes. A lot of people do. But no, you're not doomed. There's a lot of things that you can do in your lifestyle to prevent it, and you know, that's what we're really here to promote. One of my least favorite words when it comes to people who really need to get blood sugar down, because you have a lot of once again marketing ploys, right? You got the cute little girl pouring Cheerios on dad's heart because his heart healthy. But then my patient comes in with blood sugar sky high because he's eating 3 bowls of Cheerios a day, which is a huge amount of carbohydrates, right? And a huge amount of carbohydrates turns into simple sugars, and the blood sugar spikes, and they have no idea because it's heart healthy because the TV says so, right? It's like, doc, it says honey, it's not honey nut, but it's regular Cheerios. It's not even honey nut Cheerios,
no, and
right?
Now it's even better. The new thing is that it's gluten-free.
Oh yeah, gluten-free.
Yeah, it's gluten-free.
Gluten-free does not mean low carb, does not mean sugar-free, doesn't mean any of that stuff. And so cereal is something that I discuss with my patients a lot about, because it's really marketed as something that's really healthy. But at the same time, cereal is very easy, right? You pour cereal into a bowl and pour some milk into it, or soy milk into it. You're lactose intolerant. You gobble it up and you go on your way. All right, it's such an easy thing. So what are some low-carb options for breakfast that are quick? I'm going to start with Chef Tim.
I'm good for a grilled piece of fish or pan change it up a little bit. I like fish for breakfast. It's healthy and it's lean and it's quick to cook. And some vegetables, or as a fresh fruit and vegetable smoothie. Those are one of my good things that I've been doing lately. And so
That's good.
I like eggs.
You-
I can't
you
deny
like
it.
eggs?
I love eggs.
All right.
There's
So-
just no way.
So eggs are an easy thing, right?
Completely
Because-
easy. You can hard boil, you can soft boil, you can scramble it, you can hard scramble if you want, you can throw seasonings in there. I can go on there. You can go do quiches and freeze them. I
Right.
just did a bunch of them, and that's going to be breakfast for the next 3 days.
What, quiches?
Quiches.
Yeah.
Quiches. I love quiches.
You
I
love
love
quiches.
quiches. Anything sort of any eggs, the ones that you love.
Yeah, I love seasoned eggs. They're great.
So that, and the thing is that pairing it with leftovers. I mean, the thing is that I can totally do leftover veggies, leftover things that I've baked, tomatoes, even like, just washing some fruits in there, or let's say, I always go with a cup of coffee. I'm not sure about anybody else.
Okay. All right. My votes for breakfast. I also love eggs, but since Mimi already talked about eggs, I'm going to avoid it for now. Damn, I love Cheerios. Getting back to the question, what are some easy ways you can prevent type 2 diabetes? I'm going to get back to that. But let me finish this segment first. Breakfast. My breakfast is usually eggs. I really love eggs. But aside from that, here are some other things that I do. I'm Chinese, and Chinese people we eat a lot of green beans. I like really fine shredded green beans that's sautéed with a little bit of chicken or fish in the morning. And doesn't egg raise your cholesterol?
No.
Short answer is no.
No.
And that's a big stipulation that people
Yes.
have to understand. But anyways, the other things that are good for breakfast. Once again, I'm Chinese. I also like tofu. But if you guys don't like tofu, if you guys don't like eggs, sometimes on the go, I just have like lunch meat, turkey meat, with a piece of lettuce and fresh mozzarella. I love fresh mozzarella and tomatoes on it. And that's one of my favorite breakfasts of all time. And so, Mimi, why don't you comment on does eggs raise cholesterol?
And I've been saying this for many years, and I love how they came out with the new guidelines that they said foods that have natural dietary cholesterol. That's what a lot of people tend to have been talking about, lowering cholesterol, right? That it has to do with dietary cholesterol, which means foods that are naturally high in cholesterol. What it seems that it's come to light is that more of an impact on your cholesterol, raising your cholesterol in your body, is not from the cholesterol you eat, but more from saturated fats, or what you call animal fats. Pretty much any fat that you would get from an animal in that sense.
Right. Since we're talking about sugars, I'm going to tie this back into sugars. Actually, the biggest risk factor to heart disease and strokes in America is insulin resistance, which means it's blood sugar. And that has a more impact on cardiovascular disease than cholesterol does. And people are really surprised when they hear that. Sometimes if you eat a baguette for 10 years, that has a worse implication on your health than if you eat eggs for 10 years, believe it or not. But that's absolutely true. And the new American Dietary Guidelines that came out in January actually support this fact. And so, the other thing is, when we talk about breakfast items, and breakfast items, people tend to get hung up on because someone wrote here earlier that they love leftovers for breakfast, and I love leftovers.
Oh,
breakfast,
yeah, no.
right?
The quickest thing you can. So what I do is that I don't like to wash dishes in the morning or do a lot of stuff. So do everything the night before. Just make a huge batch. Put it into containers, and the next morning, all you have to do is heat it up. And it keeps the same way. The flavor's right there. All you do is just make a cup of coffee, make a cup of tea, whatever you want to do.
Yeah.
And in that case, breakfast in a snap, and it tastes just as great.
Right. Tim, what's your favorite leftovers for breakfast?
Oh,
Shrimp.
shrimp.
I know you, man.
Yeah, shrimp.
Me too. I know
I've
you.
seen the
Shrimp and fish, and a bowl of shrimp with some salt and pepper.
Someone wrote
ribs,
whiskey.
Yes.
Yeah. So I mean,
Yeah.
I'm into cooking. I like
Yeah.
good food, but I don't like to stay in the kitchen a long time. So,
Hey, I'm with you. I'm with you
thing
there.
for me is cooking quick and cooking healthy at the same time. The less ingredients that the product has, the more healthy it is.
Yeah, I'm with you there. No, for sure, for sure. All right, quick tips. Someone asked me earlier. I'm turning this camera around. Okay. So quick tips about how to prevent type 2 diabetes. Okay. So type 2 diabetes is developed for a lot of people where they become insulin resistant. Insulin is released when carbohydrates go into your body. And the more times, the more often, the longer that happens, your body can develop a resistance towards the insulin that your pancreas produces. So in theory, either use this blood sugar that you put into your body or decrease the blood sugar coming into your body. So that's really diet and exercise, right? And so, adopting a lower carbohydrate diet and a lower glycemic index diet is actually the way to go. We'll be talking about that a little more later on. I think this is long enough for one Periscope. I'm pretty tired. You guys pretty tired? But thanks for joining us. I'll be looking back into this Periscope to see if I can answer some more questions on my Twitter and on my Facebook as well. So my Facebook is facebook.com. Thank you. Facebook.com/healthydoc. Mimi, what's yours?
Mine is facebook.com/MimiChanFood. MIMICHANFOOD.
Chef.
And mine is Chef Tim Sattler. Oh, facebook.com/Chef Tim Sattler.
So TIMSADDLER.
Yes.
Right.
So pretty face.
Look for the pretty face.
Yeah.
And my Twitter, you guys find me on Periscope. You know exactly what my Twitter is at the Runway, at THERUANWAY. Thank you very much.